We're keeping an eye on this record big number today. The U.S. reporting more than 782,000 new COVID-19 cases daily. That's more than 6.5 times last month's totals.
And we are noticing, and you're noticing, Dr. Ashton not here on set with us. We did tell you last week she did come down with COVID. It was a mild case. She did have symptoms. She's doing just fine. Now she has fully vaxxed, and she had the booster as well.
Yep.
She's just one of those cases, but we're going to be hearing from her soon. But for now, let's check in again with Dr. Sutton. Dr. Darian Sutton, who's in L.A. for us, has been sitting in doing the duty for us. Good to see you once again while Dr. Ashton's been out. And let's talk about these tests. The Biden administration talking about at least half of 500 million tests were going to be available. Supposed to start, you can order them by this Wednesday, but you might not get it for almost a couple of weeks. Will you give us the absolute latest on this rapid testing and free home test now?
Yeah, so we're hopeful that these new measures make tests more available and accessible. Right now, as of this weekend, for those who have insurance, home tests are covered. Insurers are required to cover up to 8 tests per person per month. And also for those who don't have insurance coverage, as you said, we'll increase the accessibility this Wednesday on COVIDtests.gov, where families with and without insurance will be able to log on and get up to 4 tests per household per week. And then there's reportedly 50 million tests being sent to community centers around the nation. And so if you're curious about where to find your local distribution center, you can check in with your local Department of Health.
Okay, so Dr. Sutton, you got your hands on some of these at-home rapid tests. Now, how should you use them? When should you use them?
That's a great question. So rapid antigen tests are best used if you're curious about whether or not you have the infection and you have symptoms in the first couple of days of those symptoms. That's when that test is going to be most accurate. Another use or modality of the rapid antigen test is if you've already tested positive either via a PCR or a prior rapid antigen, and you're trying to figure out your level of infectiousness before you exit your your isolation into the public, you can get a rapid antigen test because it can be a sign of how contagious you are. And then, of course, you can use them for surveillance, but they're just not as accurate as PCR tests.
All right, all really important information. Thank you very much, Dr. Sutton.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.